everyone. Today I'd like to talk to you about children and Lyme disease. As I promised to you in the past, I'd like to work on presenting a case to you or answer some of frequently asked questions and have that be the format of most of these videos. So today I'll present a case of a 12-year-old boy who recently came into my office with many complaints. A lot of his complaints were both neurologic and psychiatric. So some of the complaints that mom and the boy were complaining about is a lot of OCD type behavior, as well as facial tics and vocal tics that the boy was having. He was also having quite a lot of neurologic symptoms, including brain fog, difficulty concentrating, throwing tantrums, and what we call in medicine regression, meaning acting not your age, which was very new to him because he was a very mature boy prior to this. His symptoms lasted for a couple of months before mom was able to hone in on the diagnosis. And actually, with the help of social media networks, including asking other parents and going on websites and trying to PubMed patient's symptoms and see what else could be going on, because going to her pediatrician and a number of different specialists really just resulted in a psychiatric diagnosis for this boy. However, all of these symptoms were not able to be explained by the psychiatric diagnosis, and medications were not really helping him, and in fact making things worse, especially making the OCD worse. So because he was having things like joint aches as well as fevers, and he did have a rash at the onset, he had a lot of fatigue, and he also had a lot of phobias and headaches and insomnia and dizziness. All of these symptoms were not able to be explained by just a psychiatric diagnosis. Thankfully, with the help of social media and the parents' proper use of social media, which means that it allowed the answers that were brought up on social media for mom and dad were kind of a jumping point of starting a conversation with their physician and finding the proper doctor, and they found a Lyme literate doctor who was able to test the patient and provide a diagnosis of Lyme disease. Over time, the patient has gotten better with his symptoms. However, he continued to have symptoms of OCD, which are very, very debilitating, as well as facial tics and some other anxieties, headaches, and dizziness, which were not getting better. Although his energy level has improved, but he was not able to be the athlete that he was prior to the diagnosis. And because of that, he was sent to me to assess if there's any neurologic manifestation of his Lyme disease at this time. So what we did is we evaluated the patient for different type of infections and looked for infections-induced autoimmune encephalitis that may be contributing to a lot of his psychiatric symptoms, headaches, and fatigue. And by doing a number of tests, including an MRI of the head, an EEG, some blood work, a SPECT scan, and a lumbar puncture, we diagnosed him with an infections-induced autoimmune encephalitis, and I prescribed an additional treatment on top of his antibiotics. And this patient is doing phenomenally well at this point. He's back in school, and although he's continuing to be under treatment, we are going to talk about discontinuing his treatment very soon because he's doing so well. I hope this video helps, and tune in to my next video next week.